I'm Dr. Randall Griffith, DNP, and I work in Occupational Medicine at MultiCare. As many of you may know, there were a number of changes made to commercial driver certification examinations in mid-2014. One of those changes involved a medical condition known as obstructive sleep apnea. Obstructive sleep apnea, as described by the Mayo Clinic, is a potentially serious sleep disorder in which breathing repeatedly stops and starts during sleep. Obstructive sleep apnea occurs when your throat muscles intermittently relax and block your airway during sleep. This can lead to daytime sleepiness, a potential hazard for drivers. According to the DOT Examiner's Handbook, 5th edition, evidence shows that drivers with sleep disorders are 7 times more likely to have an accident. This affects all drivers, but especially commercial drivers who spend a lot of time on the road. So what does this mean for your commercial driver certification exam? It means that during your physical, we will check your risk factors for sleep apnea. These include things like your neck size, age, and whether or not you are treated for high blood pressure. The examiner may ask you questions to help determine the likelihood that you have sleep apnea. If your risk is considered high, then you will need a sleep evaluation to find out if you have sleep apnea. You may be given a temporary CDL card to allow you time to complete the testing. If you are found to have sleep apnea that requires treatment with a constant positive airway pressure or CPAP machine, then you will need to demonstrate compliance with CPAP in order to obtain and maintain your CDL. Current recommendations define compliance as use of the CPAP machine at least 70% of the time for the past 30 days or more. Drivers who already have a diagnosis of sleep apnea should bring documentation of their CPAP compliance to every recertification examination. Drivers with sleep apnea can be certified for up to 1 year. I hope you find this information helpful. Thank you.